We know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021.
If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets. And I'm curious, I know you've emphasized, all of you, that this is a false choice, vaccinating Americans versus vaccinating the rest of the world, but could you explain how there isn't finite vaccine capacity and how booster shots for Americans does not at this moment come at the expense of first vaccine or second vaccine doses for folks elsewhere in the world?
Look, I do not accept the idea that we have to choose between America and the world. We clearly see our responsibility to both, and that we've got to do everything we can to protect people here at home while recognizing that tamping down the pandemic across the world and getting people vaccinated is going to be key to preventing the rise of future variants. We know that, we see that clearly, and we believe we have to work on both fronts as we have been. But Lev, when we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act. The science tells us that, our clinical judgment tells us that, and that was a collective decision of the top public health and medical experts in this administration. So again, we will do everything possible to protect people in our country. That's why we're announcing this booster plan. But we will also continue to accelerate our efforts to vaccinate the rest of the world. We take that responsibility very seriously.